trickling in. Welcome, everybody. Welcome, welcome.
Hi,
Thanks
everyone.
for joining us for tonight's webinar. Let's
Very
see, as
good.
usual.
Yeah, just started right off the bat. So here we are.
We'd love for all of you participants to drop us a quick hello in the chat box. Let us know who's here with us. If you are a therapist, a hygienist, a speech language pathologist, and we'll introduce you all to our amazing panel in just a second. Hi, Daniela.
And I know there are some dentists here too. So whatever your background is, let us know. Type where you're from too. That's always kind of fun for us to see where everyone's from. So
awesome. And make sure you select all panelists and attendees so that we can all see your questions. So on the bottom, just where it says panelists, go ahead and select all panelists and attendees so the rest of the guests in the room can get to know you all as well.
Perfect. I see we've got lots of people chiming in.
Amazing. And we're just going to give it just a second because I know Zoom takes a second or two to let everybody log in. But in the meantime, thank you all for being here. Drop us a quick hello. Let us know where you're joining us from and what you really would love in terms of us to cover for you today. We do have a quick presentation and we have an amazing panel of both MyoMentor graduates as well as current MyoMentor students that Sarah has invited to help shed some light on the field at large, as well as the program, the 12-week program, in terms of, for those of you who have not yet studied orofacial myofunctional therapy and are interested in integrating it into your day-to-day practice. So hello, everybody. Sarah, should we go ahead and launch the presentation?
Yeah, let's do it. So I'm just going to share my screen and we'll get this show officially on the road so that you guys can all learn about why we're here and what we're talking about. Laylee and I will introduce ourselves in just a minute too. So here we go. All right, so give me a thumbs up. Can everyone see the screen? Does it look good? Let me know in the chat.
And welcome from Peru, Marlene. That's awesome.
Oh,
great.
Wow, that's someone from Peru. That's amazing.
Yay.
Oh, good. And I see some current grads already typing in the chat. So thank you. So why we're all here today is I really want to share a little bit of information about the MyoMentor program. I know there's a lot of different courses out there. There's so many people interested in myofunctional therapy these days. And the challenge is knowing where to get trained, what to do, when you have questions, who to ask. And that was really what Laylee and I wanted to put together tonight for everyone who's just looking for information. They're trying to learn more. I asked about 8 of my graduates and a couple current students if they could come on and share some information with you guys too. So we're going to keep this as a pretty open discussion. I would love to hear what questions you have. I really do want to answer questions that you guys are wanting to hear the answers to. And I'm going to ask my graduates and some of the guests here as well. So here's what we're talking about today. It's an introduction to orofacial myofunctional therapy and the MyoMentor program. So let you go next, Laylee.
Hey. So I'm Laylee Knudsen, and I'm the co-founder and managing director of the Breathe Institute. And why we're so thrilled to be here with you all is, having known Sarah for the past, I would say, almost 3 years now, we were so blown away and impressed by the caliber of her therapy when we were working in collaboration with Dr. Zoggy to release some of her patients' tongue ties. And beyond that, we've had the great fortune of having many of our myofunctional therapists graduate her amazing MyoMentor program, and to work with Sarah hand in hand to now actually develop some of the latest standards, techniques, and protocols that we have developed at the Breathe Institute, and really join forces to make sure that her program is teaching the latest and greatest research and findings that we are developing. So not only is she an amazing clinician, but she is a phenomenal educator. And I will let her introduce herself in just a second. But my role in being on this call is to help you all answer any questions about the implementation side of things, and really what makes the MyoMentor program unique, and why we're so privileged and lucky to have Sarah co-direct our myofunctional therapy arm.
Thank you, Laylee. Yes, I'm not sure how many people I know. A lot of you guys know who I am. My name is Sarah Hornsby, but there might be some people who don't know who I am. So I'm going to give you guys a little bit of background on me. I am the co-director of myofunctional therapy at the Breathe Institute these days, which is really exciting. I am helping with online courses. We do a lot of things collaboratively together through many organizations I won't even go into, but let me give you guys a little bit of background on my story and how I got to become a myofunctional therapist. So it all started in 2010, really. I was 2 years out of dental hygiene school. You guys can see on my bio there that I went to Eastern Washington University. I started my practice in Seattle. That's where I'm from, the Pacific Northwest. So is anyone here from the Seattle area? I'd love to know. Let me know in the chat. Chat is, I know that. So I started my practice, and this was 10 years ago, and I, was seeing all my patients in Seattle in person. I was trying really hard to build up a network, but we just didn't have the same awareness back then as we do today, 10 years later or 11 years later. And I have to tell you guys, it's amazing to see how far the field has come in just the 10 years that I've been involved in it. So I did something kind of unique in 2014, 15. I decided to take my entire practice online. I closed down my physical location, and I started seeing my patients exclusively through Skype back then. So today I use Zoom, but it was very ahead of its time. Now with COVID, I think most therapists are practicing online, but back then it was not common. But I knew patients wanted it, and I knew it was something they were interested in. So that's kind of really how I got my start, and that's really how my practice grew a lot. So I started teaching myofunctional therapy in 2016 with my MyoMentor program, which started out really small. It was just a handful of hygienists who were really just wanting to learn more. They wanted some guidance. They wanted to practice therapy, but they didn't know what to do. So since 2016, it's really grown into an amazing community of not just hygienists, but also dentists. I'm very proud to say that I've had over 50 dentists go through the program, and to this day, there's, I would say, over 500 graduates of the program. So it's been an amazing course, and I think so many people have, taken it and just loved it. I'm so happy that the Breathe Institute had, some experience. They actually heard about it. I don't remember who through, and that's kind of how they connected up, and we started talking. So I started doing a lot more lecturing and teaching, and it wasn't until 2019 that I started really kind of, I guess, coming on as a guest lecturer with the Breathe Institute. But everything's grown from there, and now we're actually offering the MyoMentor program as one of the Breathe Institute's courses. So really, though, I encourage all of you guys to kind of reflect inward, because for me, it was my own myofunctional symptoms that really got me interested in this. I realized that I had a low tongue posture, and sometimes I was mouth breathing, and I was horrified. I could not believe that I had these symptoms, and I was a hygienist and considered myself pretty healthy. And I just kind of had this little crisis of thinking, how did I get here? How did no one tell me about this? So let me know in the chat, do any of you guys think you might have myofunctional symptoms? Has anyone got that far? I'm going to talk more about what those are, but okay, Kathleen says yes. Kayla, yep. Sarah, for sure. So, or your family members, that can happen too. So what I found, and maybe Dr. Connie, she's one of our panelists today. She might talk about that. I know that a lot of us have a personal connection to the symptoms, either through ourselves personally, or we find out that a friend or family member has these issues. So let's talk about what it actually is. So what is myofunctional therapy? How many of you guys know what it is? Who is familiar with it?
And I'll add to that, who all has already taken some sort of training course in myofunctional therapy and is actively practicing? So two-part question.
Yeah, let's see. I'm just going to read the chats. Kayla says she's practicing. Carrie says she is. Took the course, not practicing yet.
And Megan will touch
Awesome.
on that. And that's going to be part of what I'll be touching on a little bit later in the course about what really makes Sarah's program unique and how she really empowers therapists to take all that you've learned through any program and really successfully implement. So keep the answers coming, folks.
Yeah, we love it. So I'm going to play it's a quick video for you guys. What I find, because I get to talk to a lot of hygienists who have a lot of questions, people want to know, what do the exercises look like? What is this therapy? If you have no experience with it, you kind of want to just see what it is. So I've got a video. These are the videos that I share with my students. And I'll just play it. It's an example of an exercise. It's kind of fun. And here, you guys can just enjoy it. So. All right, so that is a really quick example of an exercise called brushing, and you can see exactly how it works. I've got the instructions there, but hopefully that will kind of give you guys a little idea of what an exercise can look like. Now, in the field, there's lots of different terms, so I know this is confusing. I like to clear it up. You're going to hear, I say myofunctional therapy. It's not technically correct to say that. We need to add the oral facial on the beginning to make it more specific. So it has to do with muscles of the mouth, the face, the tongue. You might hear the word tongue thrust therapy. You might hear the term oral facial myology. All of these are correct. It's just different ways of explaining it. And often because the words are long, oral facial myofunctional therapy gets shortened. Some people just call it myo. Is that technically correct? No, but it's just so that we can all speak a common language. So think of it like physical therapy. We teach people exercises, they do the exercises, and then we give them new things to work on. And we're really trying to connect the dots for them, like neuromuscular wise, and change their habits. So
And Chad just mentioned, it is actually, so there's a whole world of out there called face yoga that's really touching on more of the cosmetic benefits, but it's the same concept. It's essentially not neglecting the muscles, you know, in the facial structure. And it's interesting because you have folks like Megan Merkel who do face yoga, and we're very, very fortunate to be in LA and have, you know, some media attention and some celebrities that come to the Breathe Institute that are helping this make it a little bit more mainstream. So even though we all internally maybe reference it as myo, keeping in mind that myo really represents the muscle, right? So thank you, Sarah, for that clarification. I'm sure. Did you all find that a little bit helpful for those of you who may not yet have taken a course? All right, sign me up for myo face yoga. We got you, Rose. Okay, back to you, Sarah.
Thank you. Yeah, so I just want people to kind of have a clear picture of what the therapy is. So the next thing that I have to share is it's a 3-minute video. I'm just going to show you guys an example of me working with a patient. This is actually from a couple years ago, but she's got some great examples. We have some technical challenges just a bit. It's 3 minutes, so it's not very long. But I want you guys to see how she starts with the therapy, and then you'll see a 2-week progression later of how she finishes with the exercises. So I'm going to play that for you guys because I really want you to kind of see what is the therapy, what does it look like, and how does it work. So here we go. Okay, so hold that computer up, and now let's just see. So open your mouth and just keep everything as relaxed as you can. Don't let the mandible shift, and let's go left a tiny bit. Good, no, that's okay. There you go, and then right. Good, nice job. Do you feel any of that neck tension happening?
I feel like a little bit. I can almost feel like something down here moving. I don't know if it's tongue or if it's muscle.
It could be either, but you try to relax that and move the tongue on its own. So something you can do, well, let's just keep trying it, then I'll give you another tip. But so open a little wider and see if that changes anything. There you go. Don't let that jaw shift. There you go. So the jaw is getting better. So I'm just focusing on one thing at a time. Like, don't let the jaw shift. Oh, seems like it got tired.
There goes light. I have no idea what happened.
So I actually chose this because she's like, it's getting dark and it can just show a good example of online therapy.
What's that light behind you? Oh, there. There, that's
There you
better. Did it turn back on?
No, I just moved forward.
Oh, there we go. Okay, so yeah, the mandible, you can focus on just the chin first, even if you're getting this neck muscle engagement. Let's just see if you can go left and right with the tongue without moving the mandible. There you go. Now put the cheeks back just a tiny bit, a little bit more of a smile. And so your tongue has to go a little further. There you go. Perfect. So this is going to be hard, but I want you to keep working on it. Now you probably, now that you smiled a bit more, you might feel the neck kicking in a bit. So it's just going to be, this one, unfortunately, you might not be able to do it on the go. So you're probably going to have to concentrate and like look in the mirror and watch yourself for this one, because it is more about like technique. So, but we'll see how you look next time we meet and go from there. So do you have any questions about that? You think you got it?
No, I think I got that one. It's funny because I was actually starting to have a migraine, and now that I focused on like relaxing right here, it's not as bad.
Good. Perfect. It's just compensating muscles. It's from being tongue-tied, you know, it's just, we have to learn how to disconnect the tongue from all these other muscles that are used to working on the tongue's behalf, I guess. So
So here she is 2 weeks later.
And let's do the left and right tongue movement. So let's see how you did. So much better.
Can you guys tell the difference?
Your tongue is moving on its own, and you're using just the very tip of the tongue to touch the corner of the mouth. So keep going a little bit more. Very good. Awesome. Okay, I'm happy with that.
Okay, so that's just a little example, and there's some great comments in the chat coming in. Megan asked me, what about a bite block? Some of you might have heard of using a bite block to help, and that would have been a good tool. She actually, for this video, she didn't have her kit. She didn't have that tool, so we were working without it. So Andrea's got a great question. She said, was this a tongue tie release patient? Yes, so this was a complicated situation because the patient came to me and she had had her tongue tie released without doing pre-op exercises. And that's something that I talk about a lot, especially through all of the Breathe Institute protocols around tongue tie. We really want a lot of exercises on the front end. And then we have the surgery, and then we do exercises on the back end after the surgery. So great questions, you guys. I can tell there's some experienced therapists in here. So I'm just going to go over a couple more things so that you guys can all get a solid understanding. And then I want to hear from some of the graduates and the panelists who are here to answer questions. And I want to hear from you guys as well. But I think a really important thing to take away is the therapy is really simple. So we're trying to help patients restore normal function for their breathing and tongue posture. So our goal for everyone is that they breathe through their nose, their lips are together, their tongue is in their palate, and they're chewing and swallowing correctly. That sounds really simple, and it should be, but the problem is there's a lot of patients who don't do that, and it starts off from a really, really young age. So it usually starts with babies and being, either tongue-tied or having complex issues with birth, or it's a whole big topic, but it starts when we're young, and if we don't correct the issues, we end up as adults with much bigger problems. So when I see a little boy like this or a little girl with their mouth open, I see dysfunction, and that's really important for all of you guys to start thinking about if you're getting into this field. These things are common, but they're not normal. We see them every day, but we shouldn't see them ideally. So the open mouth, the low tongue, the lips apart, this is not our normal, natural, healthy state. It's not correct muscle function and posture and breathing. And if you don't address these things, they will lead to bigger problems. And this is what the latest research is showing, and what Dr. Zaghi is so passionate about, pushing the research to the forefront so that kids like this don't get worse as they get older. So when we see kids with the mouth breathing and tongue tie and low tongue, they're very, very likely to end up as adults with bigger problems. And this can be from simple dental issues like periodontal disease and increased risk for caries to sleep apnea and chronic pain. So we all see these patients every day in our clinical practice. We just don't necessarily know that there's an underlying root cause to a lot of the things that we're actually treating, without realizing that if we corrected the mouth breathing and the tongue posture, we would be so much further ahead. So that's what I want to leave you guys with, because the airway is really our focus. Sleep, breathing, airway, and tongue tie are really where all of the research is coming from. And we're connecting the dots between myofunctional symptoms and sleep disordered breathing. So all of my patients, I'm really looking at as airway patients. I'm helping, the therapy is a really critical piece of the puzzle when it comes to treating sleep apnea and snoring and TMD issues. And that's what I do in my practice every day. And that's what I talk about here. So I think let's turn it over to the grads, unless you want to say anything, Laylee. I want to ask some questions about what
I'd love to turn it over, but can we go back one slide? I want to make a point on behalf of Dr. Zaghi for all of you. For those of you who may not know Dr. Suresh Zaghi, he's our medical director. He's an ENT sleep surgeon, and we're very, very fortunate to have his support. When Sonda Valku-Pinkerton and I connected with Dr. Zaghi, it was after many attempts of sending our tongue-tied patients to different oral surgeons, ENTs, and them kind of negating or, sending patients back and saying, no, that's not a thing. And Dr. Zaghi not only came with an open mind and open eyes to really exploring how do we make these releases, especially in adults and children who've developed all these compensations, safe and effective. So we're very fortunate to have him lead research in this field. And to date, we actually have the biggest body of literature, which is a level 3 study, and I'll delve into that later, that shows that when you do these releases, tongue tie specifically, coupled with myofunctional therapy, that is when it's safe and effective. And, when he became a believer, we went from having one therapist to about 8 therapists now in our office, 7 or 8. And really myo is the central arm of everything we do, whether it's, ENT surgery, tongue tie surgery, whatever. Even now with Dr. Kevin Koppelson, who's a maxillofacial surgeon on our team, we have even developed protocols for MMA patients. And that's what's so exciting about Sarah collaborating with us, is because not only does she join in on every course, every meeting, every research meeting to make sure that whatever she brings to her students in MyoMentor is the latest information related around research. And just going back to the point of the pediatric, the smoke to fire, that's something that Dr. Zaghi preaches a lot in our courses, where if you can stop the fire from developing when it's just smoke in pediatric populations, and that's something as simple as looking at the photos the way Sarah shared, doing a quick little video recording, because with pediatric populations, one of the things we've been advocating for at the Breathe Institute is just capture a quick little video of them sleeping at night. If there's any restlessness, any movement, open mouth posture, snoring, all you need is a score of 1 in a sleep study for pediatrics to be indicative of a sleep disordered breathing issue. So instead of having to put your children or your patients through these kind of challenging sleep studies, if you just start with just some simple observation and then get them into a nasal hygiene and a myofunctional therapy program, then you're moving away from the standard of care, which right now is giving pediatric patients CPAPs. So I just wanted to touch on that, and thank you, Sarah, for bringing these points to light, because this is a really impactful and powerful therapy.
Yeah, thank you, Laylee. And Laylee might not be clinical, but she knows so much, and I love her perspective on everything. So thank you for hosting this and for having me here and doing this together. So why don't we go on? Yeah, Dr. Brester says, Laylee knows it all, she does.
Thanks, Dr. Brester. And actually, that's a great opportunity to maybe bring you on. And Sarah, I know, has some great questions for our panelists, and our panelists include everyone from dentists to hygienists to, therapists. So we wanted to have an opportunity for you all to ask others who've already gone through this program and have successfully implemented it or are currently in the class. So if you have questions like the one that Anne asked earlier, which Sarah, I just just want to read to you because I know you're lecturing. What does correct swallowing pattern look like? DDS here and starting to learn more about myo. So I don't know if you want to address that to anybody specific on the panel.
I'll address it. I'll make it quick because it's a big topic, but the tongue should not push forward during a swallow. It shouldn't push laterally during a swallow. So one of the signs that that's happening, the pushing, which is described as a tongue thrust, which also goes hand in hand with a forward resting tongue posture, is an open bite. So if you see an anterior open bite or lateral open bite, there's a high chance that they've got that dysfunctional swallow and incorrect resting posture. So the swallow should be, very little movement. The tongue should be against the palate. The tip should be on the incisive papilla area. There should almost be like a very tiny wave-like motion from front to back, and it should be very subtle. There shouldn't be contraction of the facial muscles, neck muscles. I guess that's probably the best answer I can give to that.
And we could give a visual like what you see, because that was really descriptive, Sarah. If you see someone, I'm going to try to emulate, but what you see is this, you'll start seeing movement as they're like pursing their lips. And again, Sarah described it best, but we'll make sure. I know, Dr. When you're a dentist, and we do have some dentists on the panel that can talk about how they speak and treat these issues as well. And I'll turn it back to you, Sarah, because I know you have some great questions to highlight.
Yeah, so I think, why don't we hear from Kimmy first? I know she told me she might have to go early. So why myofunctional therapy, Kimmy? You can unmute yourself. You can turn on your video if you want. It's up to you how out there you want to be. But I'd love to hear from you on why you think myofunctional therapy is important. I know you're really passionate about it. So yeah, take it away.
I tried to start my video, Sarah. It won't let me for some reason.
Okay, give it just a second. I think we've got Chad on technical duty. He'll help you.
Okay. You can't see my face, but hi, I'm Kimmy Nishimoto. I've been doing myo this is my second year, and I got into it because I was taking a class on myofunctional disorders, just a random class at the dental convention, and it was all about how mouth breathing is bad for you, and I'm sitting there with my mouth hanging wide open, realizing I had every single thing that the girl was talking about. So that was really eye-opening for me, and it kind of just led me down this path of there was no one in my area doing it, and so I was like, well, I guess I could get trained and just figure out how to do it on myself. So
Awesome.
I did, and I took one course, and it was great, but it was just very dipping the toe in the water, like the basics of mouth breathing, how to identify a very obvious tongue tie, some swallow exercises, and habit elimination. And that was pretty much it. So I went, and I didn't really know how to get started. I didn't know how to build the business side of it. I was just really excited and trying to get all my family to let me work on them. And but when it actually came down to charging, I'm very shy, and
we wouldn't think you're shy, Kimmy. At least I wouldn't.
I know. Everyone always says that to me, but I'm very shy and actually like extremely awkward sometimes. So trying to get people to pay me was just awful. So it was very helpful for me when I wanted to get into it more. I got an overwhelming response of like, take MyoMentor, like Sarah will explain everything. And that has been like very life-changing for me. I found out through taking Sarah's course that I had a posterior tongue tie and I had sleep apnea. So I got my tongue tie released. My sleep apnea is gone now. So I'm feeling much, much better, and it's just leading me down the path now to expansion. But it's been great. I have a lot of paying clients now, which is exciting.
Yay.
And I do myo pretty much every night of the week and on the weekends. So it's been wonderful. I'm very, very happy I was able to connect with Sarah and Megan.
Yeah, thank you, Kimmy. That's really great. And Kimmy is a great example of somebody who really has gone down the path of realizing that she had the symptoms, and she's worked so hard to correct her own symptoms. So thank you. That is a big why for Kimmy. Just like for me, it was working with my my own symptoms. You know, it is really important when you are in healthcare and you realize like, wow, I have this. How did I not know about it? It can be kind of tough. So thank you, Kimmy. I'd love to hear from Jessica next. I know, Jessica, we've crossed paths in the field a lot. You've taken many other courses before you took the MyoMentor program. I know that you've had a practice in Austin for a while, and you're really involved in the field. I was so excited when you signed up to take the class. I know you're in the current MyoMentor course, so I'd love for you to talk about why OMT for you, why myofunctional therapy for you.
Sure, absolutely. Hold on, thank
That's
you.
all right.
I just got my camera back on, so I wasn't expecting that, but thanks.
Good to see you.
Good to see you too, guys. I'm so excited to see you guys and be here. But yes, you're right. I have taken a slew of classes. I think I've taken almost every single thing out there. And I just feel like I just continue to ask the questions, why, getting outside of the box, right? I'm always wanting to know the why behind things. And but really and truly, I think I'm kind of like Kimmy. I just got lucky and stumbled across some random CE course that a orthodontist was putting on, and he talked about growing beautiful faces. And I thought that concept was just so weird at first. And he was throwing around this term of myofunctional therapy. I had no idea what it was. And lo and behold, 5 years later, I'm staring across the room at my little girl who's 5 and has a chronic thumb sucking problem. And being in the dental field, and also my husband is in the dental field, we were only concerned about her occlusion. But as I started studying and as I started learning, one, it's personal for me because I got to help my daughter. And when I say she's the perfect storm, she was the perfect storm. She had all the things. She was, very, very little, and she was always sick and failing school, and had asthma and ADD and ADHD. And so it's been really fun. It's been fun to see her grow and flourish, and go from moderate sleep apnea to I want to say cured. I mean, that's so fun to say.
Awesome.
She's just doing so good, and I think it's just been a passion for me. I just feel like if I could get on the biggest mountain and scream the loudest I can, I would. And I just feel like all of us in both dentistry and medicine, it's in patients that are flying under the radar. And like you said, they grow up to have chronic, disease, systemic disease, as a result of maybe something that could have been caught really younger in life. So yeah, it's just become a fun passion now, and I get to make a living at it, which is even more awesomer, right? So, but
Thank you, Jessica. I love that. And it's what I found, and everyone on this panel is the same way, including Laylee and me. Everyone who gets into this field is so passionate about it because we have these really strong personal connections, and it does become like your life, and it's fun and exciting, and it's what drives us. So thank you for sharing. I think that's a great story, and I'm so happy you're here.
Yeah, absolutely. Thanks for having me.
Yeah. All right, we'll go on to the next question, and I'm seeing lots of great stuff in the chat. Thank you guys. Feel free to ask questions in the chat too. I will pause and we'll get to those as well. But let's move on to the next question, which is why MyoMentor? I'm going to ask a few of you guys because you're all here. You're graduates. You've gone through the program. Some of you have gone through it multiple times. So I'm actually going to start with. Let's see, who should I start with? Let's do Paula. Are you on here, Paula? I don't know if she's a panelist.
I'll check now.
I'll start with Erin then. Erin, why don't you come on, and then we'll do Paula next. You can unmute yourself or turn on your video if you want, Erin. Erin's from Vancouver, Washington, which is actually funny. It's the same place that Dr. Connie Brester's from. So tell us why MyoMentor? What do you like about the program? What's exciting to you? What sets it apart? What's special? You tell us.
I really enjoyed knowing that I had so much time to be able to learn and experience. A lot of the courses that you see out there are just a few days, and I just know that you give so much opportunity for a lot of information, and it just makes it so much less overwhelming. And you do it in such a like good way of like putting it all together in an organized manner so that it's easy to understand. Um, so I think that's so great. And then also like you make it great for providers to be able to like figure out how to implement that into their own practice or a separate practice of their own. So I think it's just been a great opportunity to learn, and you could keep building off of it. It seems like every time I take it is something new. So
Yeah.
great.
Thank you, Erin. And what Erin's mentioning is I always allow graduates to come back at any point and retake the course for $500, or I have lots of volunteer opportunities where if they want to help be a TA, they can retake the course for free. So I really want people to have the latest information. The course changes every single time I teach it, and the field is constantly evolving and improving. So I always encourage graduates to come back. So when did you first take it, Erin? And then how many times have you come back?
I took it first in, I think 2019, and then I actually recently just took it again in September of
Okay.
2020. So like a couple times. And I also was able to do the mentor, the matchmaker program, which I really think pushed me to like get out there and be able to like see my first patient, because I know that that's a huge like thing to tackle on your own, and it just made it so much easier and more comfortable to have that ability to like reach out to you, or like you work really closely with Megan, and like being able to work with both of you and like have that just support and like feel like I'm not alone, and like being able to just do it.
Awesome. Thank you for sharing, Erin. I'm really happy you're here and that you're sharing all those things. Erin's also talking about the Matchmaker program, which is also called the online internship, depending on if you're the patient or the student. But I like to try to offer the opportunity for graduates of the MyoMentor program to be paired with a student and recreate that dental hygiene school model where you can kind of work with somebody and they know that you're a newbie. They know that it's your first patient, and they get a discount for it because of that. So that program I can talk a ton about later. But thank you, Erin. Why don't I bring on Paula?
Actually, Sarah, if I can touch on that for a second, for those of you who are really considering this course, why it's so pivotal. I used to be a director of development at UCLA Anderson, and it was one of the top entrepreneurial or business schools in the nation. And one of the things they prided themselves on was the placement. So when you graduated, you would get recruited by top, companies to be able to work. And that's something for those of you who may not be seasoned therapists yet or have a doctor that supports you in the field, that I know Sarah goes above and beyond to make sure that she finds, for example, at the Breathe Institute, we have affiliate offices that train with Dr. Zaghi, and she'll always go through her MyoMentor grad list and make sure she can find all the therapists that are in that state and be able to connect them. And Jessica, that's why it's so awesome to see you. Jessica is a perfect example of a phenomenal therapist in Texas who is working with our affiliates and her own husband and providers to be able to address these conditions. So I wanted to add that as a perk because it really is more than just a course. It doesn't stop with the learning. Sarah does really work hard and among her entire amazing team to make sure that not only do you all get the education, but that you can also find providers in your area to work with and to make sure that you're actually seeing patients and being paid for it and getting recouping your investment in your education as well. So I just wanted to add to that real quick, Sarah.
Thank you. I love it. I love it when you guys all add extra stuff. Paula, why don't you come on? You can turn on your video or just audio, whatever you want.
Yeah.
And
Yeah,
talk about
very
why you like the MyoMentor program or what you your experience with it.
Yeah, sure. Kind of to pair off of what Erin said initially, the program is definitely digestible is kind of the term that just keeps kind of coming to mind. My first therapy course that I took was, I use the analogy for my husband, it was like drinking from a fire hydrant. I left with tons of good information I was so jazzed about and couldn't wait to use. And I came back and I looked at all my notes and I was like, now what? What do I do with all of this wonderful information that I can't wait to deliver? And MyoMentor is pieced in such a way while you're practicing to kind of learn, and I'm always someone that thinks of something after the fact. So I'd sit and absorb it, and then I'd have questions, and then we do a discussion call, and then you get another bit of information and I'd absorb it, and I'd be.
Oh, looks like she froze. Oh, well, that's all right.
Thank you, Paula. That was beautifully
yeah.
said.
Yeah, thank you. It looks like her computer froze, but that's all right. I think maybe we could answer one of these questions. So Andrea is asking in the chat, have you developed systems, for example, a tongue tie release patient, you follow a series of exercises and teaching what markers you're looking for, and when you know the patient has completed the program? Yes, I do have all that. Maybe I was actually going to bring Catherine on to talk about MyoMentor, but maybe Catherine, since you're in the current class and you know, you're a TA and then you took the class before, maybe Catherine, that's a question that you could talk about, the templates and the systems that I have set up for you guys. What do you think? Is that too hard of a question for you?
Hey, no, not at all. Yeah, so I think I have an interesting perspective. I finished my first course in December, and I immediately joined up with Sarah to work with her as a TA for the following course. So I've literally seen them back to back, and I can absolutely vouch that there is so much new content, and just in such a wonderful way. Like, you can see that you know, there's some research and studies coming out, which is so cool. And so it's been a really neat experience. But yes, even the templates, like, they're wonderful. They give you a great kickoff point, so you can really start to grow your mind and really understand when to apply certain exercises for certain patients. But I was blown away this latest course that those templates are beautiful. Like, I am going to laminate those and have those with me because they're just such a wonderful reference. And so as corny as it may sound, you can just feel the energy that Sarah brings to every class, but also just the amount of time and effort and dedication that she puts into what she's presenting. It really is genuine, and I know that she really wants to advance this field, and that's really what, you know, I want to build and learn from those type of providers out there. So yeah, I highly recommend it for sure.
Thank you, Catherine. And, you know, I love that you're talking about that. I redesigned a lot of the documentation for that, for the newest course for kicking off 2021. I was like, all right, some of the stuff needs like a beauty upgrade. So they've been redesigned, and they do look, they look really nice, right? So
yeah, they're amazing. Yeah, they're great.
Thank you. So the other thing too that I'll add, just because we're talking about templates, I'm not an advocate for just doing, you know, a cookie cutter program for every single patient every single time. But I know that when you're a new therapist and you have no experience, you have to start somewhere. So I tell the students, start with the template, and then when you see some patients, you'll start to learn how to build on the template. So you know, you might see in different Facebook groups, you know, arguing around certain things like you can't do the cookie cutter programs, you can't use a template. I agree, but with a little caveat of we all have to start somewhere when we're new. So anyway,
I want to read Kathleen's comment because I think that's where, beyond templates, Kathleen says the MyoMentor program feels sort of like Sarah's your BFF and is the best one in the class and is willing to hold your hand and share their notes with you, and you actually get it. So you actually get it. Had to share that.
You guys, oh my gosh, you guys are like making me blush. That's like the nicest compliment ever, Kathleen. Thank you.
And I want to just touch on that point that Sarah made. And I think it's a great question in terms of like tongue ties and, you know, if there's any protocols. The one thing we really pride ourselves on at the Breathe Institute, and that Sarah teaches, is the individualization and the customization of therapy. Because for most folks who've taken a orofacial myofunctional therapy program, and I've been in a lot of intro courses, you're usually just given an exercise kind of sheet and template. And that's, you know, it's like week 1, you do these exercises, week 2, you do these exercises. But one of the things we teach in our programs is how to individualize and customize it. So if your patient is a severe TMD patient, they're going to have a different, a program and protocol than if your patient is in maxillary skeletal expansion or MMA patient. So that's something that's why this program is 12 weeks in length and not just your standard 4 days, because Sarah really breaks it down into digestible parts and gives you all activities and exercises in between to make sure that you're really understanding. So Kathleen, I couldn't agree with you more. That's one of the compliments I give Sarah all the time, is her talent and ability to take things that can be complex and really simplify it, and in a way that you can digest and share with your patients as well.
Thank you, guys. Let's go on to the next question. Oh, I have a little blurb in here because I wanted to make sure I mentioned the course is 12 weeks. It's broken into 3 modules. So in module 1, we start with just the basics of symptom identification, how to look at your patient and know that they're tongue-tied, know that they're mouth breathing or whatever their symptoms are. Yes, they need therapy. So that's what module 1 is designed to teach. Module 2 is the actual treatment program and protocols. And that's where, the exercises and the templates and all these things come in. Module 3 is the practice management portion. So this is everything from like, how much should I charge, to how do I write a chart note, to how do I find like-minded providers in my community. So that is a little slide here to remind me to talk about that. But our course does start on March 27th. So I'm hoping that, a lot of you guys are ready to go and you want to take it. And that's why we're doing this tonight. So, but to go on to more questions, how to practice. This is where I'd love to hear from. Maybe we should get the dentist to talk a bit. So you can do myofunctional therapy out of a dental office, working under a dentist, or you can do it as a private practice like I do and like Jessica does. And so there's a lot of different ways to practice, but maybe I can ask, we'll start with Dr. Brester.
Sarah, maybe you want to ask the question that Ellie posed to Dr. Brester. I think she might be a great one to answer. Dr. Brester, Ellie asks, my boss is one of four board certified sleep dentists in the state of Montana, but when it comes to incorporating OMT into the practice, she's not in favor of getting trained because it's considered hocus pocus in our dental community. How do I convince her there is scientific research to prove this works? Any tips on getting her excited? Just to note that I did include the link to our research paper to show that 348 patients is definitely not hocus pocus. But Dr. Brester, we'd love to hear from you in terms of how you would address that.
Yeah, sure. Hi everybody, thanks for having me. Probably in particular to that question, I love, Laylee, that you just sent her that. I was going to say I'd send her that paper. Couple of things, even on, just to, if she could take the breathe course, I would say that's good, but it might be kind of hard to get her signed up for that. So maybe just a teaser, even on the Breathe Institute website or on Dr. Zoggy's website, couple, like a 45-minute lecture that he has that I think he gave like in Australia. You can maybe just drop her that, like just say, hey, just watch this, this link, because even some of those quick little lectures he gives are pretty moving. And I can say too, I'm one of those kid that doesn't breathe moms, and us moms that have kids that have some issues, we do more research than the FBI. So I have just all good things to say. That's how I would answer that question. You're the best provider when you're the most well-rounded. And so I think even if there's something that you don't necessarily agree with, I think you probably need to do the research on it so that you can address whether, not just whether you agree or disagree, but you understand both sides of the coin, if that makes sense.
Yeah, I think people don't realize that there is actually so much research out there. So if they can start to kind of get more into the groups of people who are talking about the research, and maybe it takes joining a study club, maybe it takes just connecting with another provider in the community who's kind of on that wavelength. But yeah, Dr. Brester, if you want to share kind of part 2 of that question, which is how do you see this fitting into, dentistry in general, your practice, there's lots of different ways to incorporate the therapy. So how are you guys doing it, or what are you, thinking about it at least?
Yeah. So I'll kind of talk real quick to the dentists out there, because I think one of the things that is most helpful just as a dentist is when you understand like the foundations for the function of the hole that we work in all day, that's what's pretty, makes you feel really good about what you do. You know, you're not just in there fixing problems, but you're understanding how it was designed and how it functions. And then when you understand how it should function appropriately, then you can address what's not functioning appropriately. And for dentists that are wanting to get into this field, it's really important to do your research and to be able to communicate clearly, especially as you start building your team. So, you know, as I work with other myofunctional therapists or speech pathologists or ENTs, you have to be able to talk their talk, and you have to know, you gotta know your stuff. And so I think, especially for MyoMentor, I wanted to take it for a couple reasons. One, so that I could properly diagnose disorders. I could communicate it to the people that I worked with. And then if you're really interested in, you know, doing a functional frenuloplasty or, you know, providing the surgical care, then you have to know what the endpoints are for therapy. You have to know when somebody's prepared for the procedure, mentally and physically. And so that's what I've really loved about MyoMentor. I was able to kind of get even a more broad understanding. I think it makes me a much more well-rounded provider.
Yeah, I love that. Thank you for sharing. I love hearing the dentists who are like fully on board with all this stuff and they get it and they're passionate and stuff too. And I know Dr. Billy Adams is in the same boat. So, you know, do you want to come on and kind of share your thoughts on the field too, Dr. Adams? Oh, you're muted.
Sure, let me unmute myself. So anyway, hi. Yes, I have so much to say. But I'm gonna just start off with first how I got here, because I think that's important too, especially to Ellie's question. I first got into sleep and treating patients with oral appliance and doing all the dental sleep medicine. And always I would be puzzled by certain things that didn't go as I thought they would. And before I learned about myofunctional therapy and tongue ties, I was like just boggled by what I was missing. And once I found that, I'm like, oh my gosh, this all makes so much sense. So I met Sarah at the Breathe Institute when I took Dr. Zaghi's Breathe course and the functional frenuloplasty. And in that course, I'm like, okay, this is all great. It's right on with what I need, but I don't even know what like a tongue tie and the compensations and how am I supposed to cut on this tongue when I'm not even sure like what's happening here. And so when I talked to Sarah and she's like, yeah, take the course and you can learn about it. And I thought, well, maybe I'm not even going to do the oral myofunctional therapy, but would the course benefit me? So I really took it so I could better understand. And actually now I implement it in so many ways. So I have a great therapist. I have actually a few great therapists in my area that I use and refer to a lot, but there are certain patients that I actually do the therapy myself. And I started working with adults in sleep medicine, and now I'm actually gearing more to working with young children and trying to catch these things much earlier because it's so much more complicated to work with the adult patients and trying to treat them with oral appliance because they can't do CPAP, and you're thinking about doing a frenuloplasty, but they don't have any space. And so going to a population where we can actually correct these things before they turn into the big complicated messes is really important. So I think implementing myofunctional therapy, oral facial myofunctional therapy into the dental practice, I hope one day will become part of every practice. It's in children's growth and development, anybody going through orthodontic treatment, adult patients, orthognathic surgery, TMD patients, whether it's joint or muscle. Even I do Botox and fillers, and we talked about facial aesthetics. I mean, there are so many ways it can be part of your practice. And what we've heard before is that when you understand these things so much better, you can better diagnose your patient, so you better treat your patient. And I think getting as much information from anybody that's out there that wants to or is trying to explore this, MyoMentor was a great program and it was very informative. And even if you are a dentist and you just want to know more, it has really helped me a lot better treating my patients. And so I would say go for it.
I love that, Dr. Adams. And Sarah, if I can add something to that, Thank you for sharing all the clinical applications. I know with the Breathe Institute and the Breathe course, we mainly hone in on how myofunctional therapy fits pre and post frenuloplasty. But what's awesome about the MyoMentor program and why Sarah's working so closely with all of our doctors is so that she can bring the best of all the different protocols. And that was for those of you who saw the article we did with Kourtney Kardashian on Poosh. They were so focused on the cosmetic, and that's what they mainly wanted us to focus in on. But we went deep. We talked to them about mouth breathing, lip taping, and where beauty really first starts. So thank you so much, Dr. Adams, for sharing all the other avenues. And I used to be a practice consultant in a lot of dental offices that have done every type of TMD treatment and sleep apnea treatment. And I can tell you, myofunctional therapy is the missing arm in about 90% of what is going on in the dental space, because we're ignoring the soft tissue, we're ignoring this dysfunction and the major role the tongue plays. So thank you to all the doctors in the room that want to take this course and learn how to best support your community, not only the therapist in your office, but the community at large, because this is the most conservative first stop, right? Before Dr. Zaghi does a tonsillectomy, he doesn't schedule patients for tonsillectomies. We always start with, let's try to do a nasal rinse and nasal hygiene and myofunctional therapy, and then we'll reassess. So it's powerful stuff, folks. Thank you for sharing.
I think it is the future and it will be the standard of care. I just don't know how long that will take. I hope it's sooner than later, but it's pretty much like the destiny of all of these things because they're so critical and helpful. All right, a big question that me and Laylee can talk about. I won't make anybody else talk about this, but what about the money? I know a lot of people are kind of hesitant to ask about this. They want to know if I'm going to, practice this, can I at least make the same amount of money as I do as a hygienist? A lot of people, when they're thinking about doing something new, it's a consideration, it's a realistic question to have. And yes, the answer is you should be able to make the same amount of money doing myofunctional therapy as you do doing hygiene. You just get to do something, I think, a lot more fun. But the going rate for myofunctional therapy is somewhere between $100 a session to $200 a session. And that depends on if you're in a small town or a big city and kind of how well known it is in your area. And so if you're seeing a patient for, that amount, you can kind of start to calculate, and compare that to your hygiene wage and how that might look. So I put this in here because I know a lot of people want to know, like, will I get paid the same? And yes, you should be able to make the same money, if not more, doing myofunctional therapy. So,
and the beauty about this is, and folks are saying how, I think Megan, you were talking about how much it's grown. And part of that was access to care and access to therapy. So prior to a bunch of all of you essentially, and all you therapists going out there and spreading the word, myofunctional therapy or therapists were far and few between. And there were therapists that were charging upwards of $475, believe it or not, a therapy session. And not to say that we're not saying to go down that path necessarily. All we're saying is that now it's become so much more mainstream and we still have a long way to go, but it's also reimbursed by medical insurance. So for those of you who are working in collaboration with a dentist or an ENT, oral surgeon, what have you, we do, and we talk about this in module 3 of MyoMentor, is how to monetize and successfully, bring the new production into your office and help your patients get reimbursed for the services, very similar to what you would with physical therapy. And I know, Sarah, in terms of, there were a few questions that were, if we missed any questions, what we will do is, as a follow-up, we'll send this recording to all of you in attendance, and we'll make sure to give you all some samples of what a tongue thrust looks like, sample ranges of what, therapy costs. So if you still have some questions, because I know we're approaching the hour mark that we have not yet answered, please put them in the chat box and we'll make sure that our team will send you a follow-up with those answers attached as well.
Yeah, so I mean, the last question I was going to talk about, and I know we haven't heard from Stephanie or Lael or Megan, is what advice do you have if you are, talking to a hygienist who's interested in getting into this field, or who's interested in getting trained in myofunctional therapy? What advice would you give? So just for the sake of time, Stephanie or Megan or who else? Lael, do you guys want to just quickly say like a quick soundbite of what your advice would be? Let's start with Lael. Want to unmute yourself? If she's there.
she's here. Let's see.
There you are.
I'm here. So the short answer is just sign up for MyoMentor, right, Sarah? But I think that the best advice that I can give is honestly just, it's amazing to see other hygienists that I have recommended this program to. There's actually two, Sarah, one on the West Coast and one on the East Coast, that have done your course, and they're successfully practicing now. It's just so wonderful. It's a nice atmosphere. I've connected with a Breathe Institute affiliate that I'm going to be starting working with, that I found he's like an hour away from me. And yeah, just in that connection and just the confidence to find other providers, other myofunctional therapists. And Sarah also has in her group, I think it's important to know, this time around, I'm taking it for the second time, but there's a speech language pathologist, which I love seeing in there because they have such a different viewpoint from a lot of things from just dental. So you don't just get Sarah, you get speech language pathologists and orthodontists and dentists chiming in. So you get like all of their knowledge as well. That wasn't short, but go sign up.
And Sarah, I know there was a quick
that was really, I think that was some great advice. Let's hear Stephanie, if you want to go next. I know you're currently a student, you're in the current class, and I brought you on to share kind of what your thoughts are. So do you have any advice that you'd give?
Yeah, I would just say that personally, I started listening to as much information as I could get prior to starting. Like, I listened to the podcast that you did on the Tale of Two Hygienists, and I took the free crash course that you have on your website, and just that little taste of knowledge just made me want to know more, just as a life-giving way to help the patients that I've been seeing for years and years and years, and you feel like there's no way else to help them. And now I'm seeing everybody from a completely different perspective.
Awesome. Yeah, it is true. I mean, you start to see like everything's like through like a new lens, right? So
right.
Thank you, Stephanie. Let's wrap it up with Megan. I know, so Megan has been like a colleague, a friend, a partner in business with me for a long time. We've worked together since 2016. And so I could go on and on about Megan, but what's your quick advice, Megan? What would you say?
All right, you said quick, so, and you know that's not me. So you guys can always like email me if you want like longer. But honestly, it's don't be afraid. Don't be afraid to try something new. Don't be afraid to expand your career. Don't be afraid of looking silly. Don't be afraid of not knowing all the answers. I found Sarah years ago. I think actually 2014 or 15 is when we first started talking. Took her course in 16 and have taken it every year since. And honestly, I had no idea what it was. And, you know, I just got in there. I practiced on my dad, the world's loudest snorer, just to see if we could get him to stop snoring. And everything has just kind of grown from there. So just don't be afraid. You're not making a bad decision. Don't let people who don't know what myofunctional therapy is question you. Because honestly, like, none of us knew what it was, and yet here we all are. So I think that's the shortest I could make it.
Thank you, Megan. I'm just going to skip forward to the next slide. So just to give you guys the idea of like what it costs, what it is, if you're ready to join, we do have a regular price, which is $2,500 for if it's just you. If you sign up as a team, like, you know, if you want to practice with somebody else, it goes down to $2,250 per person. If you have like a dental office and you have a dentist and two hygienists, for example, who want to sign up and take the course together, it goes down to $2,000 per person. So I'm going to leave you guys with my email address and my website. So if you have any questions, if you're interested in registering or signing up, or if you just want to talk with me or anyone else here, I'm sure they'd be happy to chat with you as much as I am. So let us know how we can help. And I think
I'll add one last thing to the last slide. I'm a big business structure person. So for those of you who maybe looking at the financial side, keep in mind, we charge about $200 a therapy session. It's kind of the norm, $150, $200. So really the return on investment is 10 patients. And if you're doing this successfully and you're seeing at least 10 sessions, sorry, yeah, 10 sessions, 10
one.
patients, 1 session each really is all it takes to get reimbursed. And, you know, Sarah will go over all of the financial side, and module 3 is all on how to successfully get you all to incorporate this in your respective practices. So I hope that little bit was helpful. We hope all of you found this informational session helpful, and we're so grateful for all of our guest speakers coming on tonight and sharing their experience with you all as well.
Yeah, thank you guys so much. I mean, all of the panelists, you guys are awesome, and everyone's like, I could just like feel the love. So thank you guys, and thank you for everyone who took time on Wednesday night. I think it's Wednesday, yes. So thank you for taking time out of your Wednesday evening to listen to this and to learn a little bit more. Please let me know if you have questions. Reach out to me, the Breathe Institute. I've got all the information there for you. So I'd love to hear from you. And I think that's it.
I have one last thing to add for those of you who think the March 27th date is too quick of a start. Keep in mind that Sarah usually gives like a 2-week grace period where you can catch up with the recordings for the first 2 sessions and then get back in the flow. And if not, the next course, I believe, is it in June, Sarah?
It's like late June. Yeah. So it'll be in a few more months.
Great. Well, thank you all so very much, especially to all of our brilliant and beautiful panelists. Thank you, ladies. And we hope you all found this helpful. This was just a little appetizer because there's so much to learn. So thank you all. Enjoy your evenings, and we hopefully look forward to seeing you all at the next course. Thanks, everyone.
Guys. Bye.
Bye, everybody.